Hi, I'm Dr. Burkholder. I'm a board certified emergency medicine physician and I live in the Tampa Bay area. I now run a concierge medicine practice called Olympic Concierge Medicine. And the big hype nowadays is AI. AI is in everything and it's definitely in medicine. And the question that a lot of people have is how is AI impacting doctors' decisions? Is it better than doctors? Is it not as good as doctors? Are there gaps? How are doctors using AI? Right? How does it relate to the liability for doctors? And should patients be informed if AI is making a diagnosis? So I'm going to talk a little bit about that right now. And the truth is that AI has definitely changed my practice. It really, in the past 6 to 12 months, there's actually AI tools like a chat GPT for doctors. And so that really helps me to just find these little nuanced questions, like answers to my questions, much quicker than it may have taken me in years past, looking up different research articles. And what it does really is it summarizes, for example, PubMed. There's a lot of medical research, scientific research on PubMed, and that's where doctors and scientists publish their medical research, and that's where a lot of American medicine and a lot of the medicine practice globally is kind of based upon, right? So when we look at PubMed, it takes us, a typical doctor, scientist, maybe 20 minutes to read a full article, maybe even longer, could take an hour. But ChatGPT or the medical AI that doctors have can literally summarize hundreds of articles in seconds and come up with a diagnosis for maybe a nuanced question or problem that we're having. A lot of the times doctors, after years and years of training, can make a diagnosis pretty quickly. But at the same time, there's always that gray area and difficult diagnosis that is needed. Requires more research, and so AI has definitely helped in that sense, and just for a variety of other things, right? ICD-10 codes for insurance billing. It's helped me look up different ICD-10 codes when ordering MRIs or CAT scans or X-rays, so that insurance covers all of that, right? I think it falls short in the sense that there's no replacement for like real world experience, right? So as a physician, you go through 4 years of college, 4 years of medical school, 3 to 4 years of residency, sometimes 5 or 6 years of residency. And there's just so much knowledge and experience that a one physician has through all of those years, all the different patients they see, all the different encounters and challenges and things that are learned and procedures that are done. There's so much. It's an unbelievable amount of information that one physician must kind of retain in their head. And there's a lot of things that we forget, right, from some of the earlier years, the basic sciences that we study in college and then also in medical school. But there's this, we do gain this kind of wisdom, right, from experience of practicing medicine. And they call it the practice of medicine because it really is a practice. You have to continually be learning, practicing our craft, our diagnosing skills, our examining skills, our treating skills, right? And so I think that AI will continue to fall short, uh, when you compare it to just the unbelievable experience of a single physician. Um, and so I think right now it's really meant to kind of augment physicians. I don't think that it's a good idea at this point yet until it's proven that it should be diagnosing patients without a physician's expertise and exam and insight. I think when you get into that realm, then you kind of venture into a high liability world where you know you have a computer diagnosing you. That it's just very difficult to think about a computer making these decisions, prescribing medications for patients without talking to them, seeing them, touching, feeling them, examining them. There's a lot of information we get from listening to the heart, right? Listening to the lungs, um, palpating someone's abdomen to rule out an appendicitis. So there's definitely a lot of details there that just aren't figured out yet between AI and AI being the kind of sole provider for somebody. I don't ever really see that. I think maybe there's companies that will do that, realizing that there will be a significant amount of liability with that, but there will be. I think it will help doctors over time as we expand the kind of the breadth and tools of AI and so on and so forth. So I think what concerns me most is that part of medicine, or that part of AI, that it's kind of diagnosing people without having the experience of a real doctor. I think what excites me though is the amount of things that we're able to do as doctors with AI can really help us enable more people to get better and more clear diagnoses, better care, quicker care, more efficient care, and take the pressure off of doctors, right? There's currently a lack of supply of doctors in the United States, and I think probably around the world, and there's an increasing population. So we have, the baby boomer population in the United States, and that's going to put a huge burden on the U.S. medical system, over the next 5, 10, 15, 20 years, and we really don't have enough doctors to service those patients. And so if we can be more effective and more efficient with AI, and I'm already seeing this when I do my notes, for example, with patients, I have an AI listening. I tell my patients, hey, there's an AI listening that's going to help me with my note, and within 1 minute after I click stop, the conversation's done, the appointment is done, my note is done. And I pretty much go through, I look at that note, I make sure there's no major issues, and then I sign my note. And, for years and years, I can't tell you how many thousands and thousands of hours I spent going through, seeing patients, and then writing my notes afterwards. And that was a painful experience. And now it's pretty much all done for us with AI. So that's very exciting. I think there's going to be more things like that coming out to help doctors. We're very busy, and I think that AI will definitely be a benefit for medicine and healthcare overall. Take care. I hope you enjoyed that.